Hi everyone, it's Dr. Bishop here. In this video, we're going to go over a validity checklist for an article about harm. Let's review the case in the article that we chose. You are on your third year primary care rotation and are seeing a geriatric patient who has relatively advanced dementia and is now having behavioral issues of combativeness and confusion. The resident with whom you are rotating is considering a new antipsychotic for this patient, but has heard reports of complications with these medications and asks you to find evidence in the literature about the harm of atypical antipsychotic medications. You come up with this PICO question. In older patients, are antipsychotics versus no antipsychotics associated with kidney injury? You then searched the literature and came up with this article. You plan on going through the 3 steps of critical appraisal to determine if you believe the results, what the results are, and how you might apply these results to patient care. In this video, we are going to go over the first question. Are the results of the study valid? Like all validity checklists, the one for harm is available on the JAMA Evidence website. If you click on the user's guide and then go to the right sidebar, you can get the checklist. We are going to focus on cohort studies in this video. There is also a slightly different set of questions if you are looking at a case control study. The validity checklist for an article about harm is only one domain. We want to know, aside from the exposure of interest, do the exposed and control groups start and finish with the same risk for the outcome? We can answer this question by looking at 3 more specific questions. First, were patients similar for prognostic factors known to be associated with the outcome, or was statistical adjustment done? Second, were the circumstances and the methods for detecting the outcome similar? And third, was the follow-up sufficiently complete? Let's focus on this first question. So were patients similar for prognostic factors known to be associated with the outcome, or was statistical adjustment done? If the outcome is kidney injury, there are a lot of things that can predispose an older patient to develop it. Just off of the top of my head, I can think of a few things. A patient's age, a patient's underlying kidney function, other medications, and other illnesses. It would be very unusual for patients who were on the antipsychotics versus those who weren't to be completely similar with regard to all of these factors. Let's take a look and see. The traditional Table 1 that shows the characteristics of patients who received the medication versus those who didn't is in a supplement in this article rather than the body of the article. There is a copy of this supplement on Canvas. If we look at the relevant table, we can see that the patients who took an atypical antipsychotic were quite different from patients who didn't. For example, patients who got the antipsychotic were older, they were more likely to be women, and if we scroll down, we can see that they had very different comorbidities. That is, they had a number of different medical conditions compared with patients who didn't get antipsychotics. Unlike the randomized controlled trials that you learned about to compare therapies, these comparison groups are very, very different. But if we look at this table, we can see another set of columns that describe a matched cohort. As you can see, the patients on antipsychotics in this cohort are very similar to those who did not receive antipsychotics. For example, their ages are much more similar, their genders are much more similar, and if we scroll down, we can see that their comorbidities are much similar. The authors have used a statistical technique called matching to create similar comparison groups. If we go back to the main article, we can see where the researchers describe this technique. They describe a cohort of older adults with evidence of new outpatient prescriptions for an oral atypical antipsychotic drug, and then they describe a matched group of drug non-recipients, similar in health status to the recipients. The researchers then describe something called propensity score matching, which is quite a sophisticated statistical technique to control for the differences between patients who received the medication and those who did not. Going back to our checklist, I think the researchers were able to control for many important variables, so I will give that question a check mark. The next question is, were the circumstances and methods for detecting the outcome similar? If we go to the PDF, we can see that the researchers used a single database and a standard method for identifying the outcome. They write, "We followed patients for 90 days after the indexed date to assess a pre-specified outcome." They also write that the primary outcome was hospitalization with acute kidney injury, or AKI. If we go back to our checklist, we can give that question a check mark. The next question is, was the follow-up sufficiently complete? This is an important question because if we don't wait a long enough time to see if the outcome happens, we may underestimate the effect. We also want to know how many patients were not followed up. If this is a high number, we also risk underestimating the effect. Let's go to the PDF. The researchers say they chose a 90-day follow-up time period for several reasons. They write, "We chose 90 days to follow on acute adverse events, avoid potential crossovers between the two groups that might occur with longer follow-up, and mimic the duration of follow-up described in clinical trials of atypical antipsychotics in older patients." I think this is a reasonable follow-up time, but some people might argue that a longer follow-up time is necessary. This brings up the point that has come up over and over again, that validity sometimes has gray areas, and you have to use your judgment. Going back to our checklist, I'm going to give that question a check mark. Now that we've completed the validity criteria, let's pull everything together. Looking at our full checklist, we can see that the authors used statistical methods to control for characteristics that may affect the outcome. They also measured the outcome similarly for all patients in the study, and they had a good follow-up time. So the question is, are the results valid? Remember, validity is a spectrum. Studies can be weak and studies can be strong, or they may be somewhere in between. In the case of this study, I think they met all of the validity criteria, and so I believe that it was a strong study. Now that we've decided that it is a strong study, and we believe the results, it's time to interpret those results.